How's it going, everybody? So we are here again with another podcast, videocast with Sonora Hearing Care in Tucson, Arizona. And we realized, Dr. Moore and I realized her patients are probably going, who is this guy? Who is this random guy that got picked up off the street, sequestered in a room to be interviewing? So my name is Carlos Spada. My company's name is Nexus Media Group, and I actually work behind the scenes. I do the website. I do the search engine optimization. We go in and create strategies for the content that's going to be applied to search engine optimization. So that's who I am, and that's kind of why I'm asking these questions, as opposed to, again, some random guy that nobody knows, and even maybe Dr. Moore doesn't know, and he's asking these questions. So. And with that, we just uploaded a video, and even yesterday we were like, hey, things change daily. Well, apparently things change by the minute, because as soon as we uploaded that video, it went live, and then I got a text message from Dr. Moore, and it was like, hey, the governor of Arizona just informed us of new information, literally minutes after we had uploaded the video. So, Dr. Moore, can you tell us of what these changes are?
Absolutely. Hi, everyone. So I'm Dr. Cristi Moore with Sonora Hearing Care, and I just wanted to update everyone regarding that the new ordinance that the governor of Arizona had just put out, indicating that we now have a stay-at-home order, and that went into effect yesterday, March 31st at 5 p.m. Arizona time. And what that means is that all non-essential businesses need to shut down through April 30th. And you can still go to places like your doctor's appointment or anyone that's listed on the essential business lists. So in healthcare, we would fall under the umbrella of essential businesses. And as I had mentioned before, audiology is essential as far as we provide a great service to those that can't hear well. However, we as a business decided that we would probably fall more within the non-essential business, and that's also guided by our professional audiology organizations as well, because we don't perform life-saving medical care. Therefore, we consider ourselves non-essential. And we're doing that mainly for the health of our patients, as well as the health of our staff, to make sure that we stay safe and that we're not causing or contributing to any spread of the virus. So while it's inconvenient and while it kind of isn't what we want to do, we feel that it's important enough that that's what we need to do during this time. So just because our doors are closed doesn't mean we're not here for you, literally. So one of the things or actually a few things we're going to be doing is we are still going to be available. Myself and my staff, we're all working from home right now. I am actually in my office right now doing this video conference because I wanted to come into a place that was a little bit quieter than what's going on at my house right now. I'm having to take over also being a homeschool teacher to my son. So that's been a really fun type learning experience for me as well. My husband's working from home as well too. So I wanted to come here so I could explain this a little bit more with not a whole lot going on. One of the options we're going to have, obviously we're still going to be available by phone. We're going to have hours between 10 a.m. and 2 p.m. One of our staff members will be available to answer the phone during those times. And we can answer questions and take messages, etc., and then we'll determine what we need to do with that. So you still have that capability to do that. You can also get us by email. Most people have our email, but I'll give that information at the end of this interview here. And then one other thing we're implementing that I had said we weren't sure if we were going to at the last meeting, but we do have some telehealth options. And what that's going to look like is kind of very similar to how Carlos and I are seeing each other right now on video. So what that means is that through our operating software, we can actually generate an appointment for telehealth. And what that means is we can send you a link to your email. You can open it up and then be able to see us on camera, just like we're doing right now. And then we can answer questions or concerns you have. If you have something with your hearing aid that's not working right, we can take a look at it through video and try to walk you through that step. So we can provide you with some services and things that way. You do have to have some equipment for that. You have to have a computer that has, and you have to have internet or Wi-Fi, and you have to have a camera and a microphone so that we can see and hear what's going on. You can also use your smartphone, like an Android, iPhone, or tablet. Those will work as well. So those things are something you need to have, plus an email address, obviously. Those are essential things that you need to have. But it's just one more way that we are trying to offer a service to you. Since we can't see each other face to face, it's one more way that we can say, this is what we're trying to do in the interim, since we're going to be shut down for about a month before we can get people to come back in and get business back to normal. So that's what we're doing right now.
Awesome. So you were adjusting with the times. You guys are evolving. You guys are going, I always look at it as just going with the flow, going with where the industry needs to be. So you're able to, again, still continue to communicate with your clients, use video conferencing like telehealth. And so that is great news. Okay. So Dr. Moore, is there anything else that you would like to tell your clients? We're
not going anywhere. We fully have the intention of opening up again and resuming business just like we always had. We've been in existence for 31 years. We're not planning on going anywhere. So I want people to understand that just because we're closed right now, this is very temporary. We're following the mandates recommended to us by the CDC, by our governor of Arizona, as well as our professional organizations. And this is what we have deemed is the best course of action for us at this time. But we fully expect to be open again. May 1st is when we're going to be open again at this time. But as we've been saying, that could change. If things change, we're going to let you know. We're going to be updating you with email blasts. So if we have your email address, you've already been receiving emails. We will continue to do that. We will post updates on the website as well as social media like Facebook, LinkedIn, those places as well. So you can find that information there. We're still going to be available by phone, so you will get that information and be able to talk to us as well. On May 1st, when we open, we will start seeing patients again on May 4th, so that following Monday. And things might still be a little bit different because just because we're shutting down to try to prevent the virus doesn't mean the virus is going to go away by May 4th. Just means that the likelihood of transmission is hopefully going to be somewhat less than it is right now. So we will still have a lot of safe procedures in place. We're still going to practice really good stringent infection control, making sure we disinfect between patients, that we disinfect all of our surfaces. Some of our appointments may still be done curbside for some of our clean and check appointments as well. And that's to help minimize the number of people that are in our waiting room at one time. So we're still going to ask some questions. You know, have you been in contact with anyone who might have been sick, exposure, things like that. Again, that's for your safety and ours to make sure that we're trying to do everything we can to minimize any effects. But we are going to be open. We are here, and we are planning on being back in business just as soon as it's safe to do so.
Awesome. Well, Cristi, thank you very much for joining me today. Thank you for this wealth of information. And for the viewers, please like, subscribe, ring the bell for notifications, especially considering that this information is changing by the minute. That way you get up-to-date information. But again, you'll be able to find this video on Facebook, all social media outlets, as well as YouTube and the website. So thank you again, and be safe.